Welcome back to Coffee Convos on Trauma Coding, where we sip with intention and code with confidence. Name That Fracture is our first series of the channel. I do hope that you can tune in to all 12 episodes in May. I'm Amanda Truelove, and for those who may be taking your first Coffee Convos on Trauma Coding break, in this series, we're breaking down named fractures one pattern at a time so that you can identify the injury, understand the anatomy, and make better coding choices with confidence. Pour your coffee and let's get into it. Today, in episode 5, we are going to be taking a closer look and heading into the hand for an episode called Thumbs, Knuckles, and Coding Clues. AI was used in the generation of the illustrations for this series. The illustrations are to help teach trauma coding concepts and fracture pattern recognition. The education visuals are not intended to be exact injury procedures, interventions, or even patient-specific anatomy. Always follow provider documentation, imaging, operative records, official guidelines, and your facility data source hierarchy and policies when performing your professional duties. Ethical coding is our expectation from this education. Now, this episode is all about Bennett, Rolando, and Boxer. These names may sound familiar, but in trauma coding, the eponym alone is never enough. Now, hand injuries can look simple at first. A broken thumb, a metacarpal fracture, a hand injury after a punch. But as coders, we know the moment we slow down and look closer, those simple labels can turn into very different injury patterns. Today's eponyms are not defined by bone alone. They are defined by location, joint involvement, fragment patterns, instability, and sometimes whether the injury is a more straightforward fracture or a more complex intra-articular pattern. Now, before we get into the fracture review, here we have the coding lens for the episode. So episode 5 is going to teach you to look beyond that metacarpal fracture and to identify the exact location, articular involvement, comminution, and instability that define the true hand injury pattern. So when you hear Bennett, Rolando, or Boxer, your first thought should be, what metacarpal is involved? What part of the bone is fractured? Is there any joint involved? And is this a simple or a more complex fracture pattern? Because the coding mistakes here are often just reducing all of these to a metacarpal fracture or some sort of hand fracture. And that is just not enough. So a practical coding lens for episode 5 is 5 steps. Number 1, you need to identify the bone and the location. Start asking yourself, is this the first metacarpal or the 5th metacarpal? Is the fracture at the base or the neck? Step 2, determine whether there is joint involvement. Asking, whether the fracture extends or looking to dissect that data source to see if you have carpometacarpal joint or is it intra-articular? Is there some sort of subluxation or dislocation injuries? Number 3, you need to assess your fracture complexity. So you should be asking, is the pattern relatively simple, like a classic Bennett? Is it comminuted, like Rolando? Is it a common but still specific neck fracture, like Boxer? Now, we can't stop with a 1, 2, 3. No, not you and me. Number 4, we need to also look for instability and angulation or rotation. This matters especially for your Bennett with that carpometacarpal instability and Boxer with that angulation or rotational deformity. But 4 is not enough. We have to take it one more step. We got to go all the way. We can count to 5. Now we need to code the full hand pattern and not just the metacarpal. That is our core teaching point for this episode. So in episode 5, we're going to start every time we see these eponyms after we learn what we can today, and this full pot of coffee today too. We're talking about what exactly is fractured. We're asking, is the joint involved? Is it simple pattern or is it a comminuted one? What are the details of the chart and how do they change the coding choice? Because not every first metacarpal fracture is the same. And not every fifth metacarpal injury should be treated like a generic hand fracture. That is the final coding lens discussion for today's episode. Take a sip and take a note. Do not code the hand injury by bone name alone. Code the pattern, the joint involvement, and the fracture complexity. With that, we're going to get into it. So Bennett fracture is a fracture that occurs at the base of that first metacarpal, but it extends into that carpometacarpal joint of the thumb. So classically, this is an intra-articular fracture. It is often associated with some sort of subluxation or even dislocation at the thumb carpometacarpal joint. Okay, then, when you hear Bennett, you need to think base of thumb, joint involvement, and instability. Do a quick dissection of the data source. Check for that pattern of injury. What is fractured? That's your first question. Well, what is fractured is the base of the first metacarpal if it's a true Bennett fracture. And this is not just a thumb metacarpal fracture. This pattern involves the joint surface. And the thumb metacarpal may be pulled out of alignment, creating that carpometacarpal subluxation or dislocation type injury. So this is a hand injury where the joint relationship matters just as much as the fracture line. That is going to be critical detail when we are looking for code assignment and choosing which code best represents the injuries. So we're asking ourselves, like always, is this isolated? Is it a combination code? Is there a fracture plus a separate associated injury? So we're going to have more than one code assigned. So your Bennett is best understood as this intra-articular base of the thumb fracture with an associated carpometacarpal instability. So that's our pattern, and that's what we need to keep in mind as we decide how we're going to code this and which code we're going to assign. So it's not just that generic first metacarpal fracture. And while the exact ICD-10-CM selection always depends on the documentation, our coding mindset is this. Recognize that fracture, recognize the joint involvement, and do not miss the subluxation or dislocation language when it is documented. That's your documentation pearl. That's the biggest pearl for documentation today. But the other documentation pearls, as always, they include, the provider documentation about laterality, making sure, double checking. They may call it a Bennett, but is it truly the first metacarpal base fracture? Is there actually intra-articular involvement? Is there displacement or not? Is this an open fracture pattern or closed? And then, of course, that subluxation or dislocation of that carpometacarpal joint. So the details matter because the eponym alone does not replace the anatomy. If we make that mistake, we'll end up spilling the chart. So coders commonly miss and make mistakes when they hear Bennett and just reduce it to a simple thumb fracture. They're like, oh, Bennett, that's in the thumb. No, we know, yes, it's in the thumb, but it's not just a simple thumb fracture. Another mistake is missing the fracture as an intra-articular involvement and may even include some carpometacarpal instability. So if the joint relationship is documented, that should not be ignored. So your take-home sip for your documentation and the details for Bennett fracture is that a Bennett fracture is more than a broken thumb. It is an intra-articular base of the first metacarpal fracture with possibly some carpometacarpal instability. Now we have our code assignment for Bennett fractures in S62.21 subdivision of the code. And then, of course, we have that laterality, right, left, and is 1 and 2, respectively. And then in those situations where we have the less than desirable documentation situation, so they don't tell us, we have 3 to represent that unspecified hand when we don't have that laterality. So your Bennett fractures actually are a combination code in ICD-10, so you can assign it out, and our tabular list provides us with that Bennett fracture. Now, it does not include the details for that carpometacarpal instability, so you just want to make sure that you assign all the injuries, but we do know, based on what's here, that with your Bennett fracture, you have that base of the thumb fracture, and it's an intra-articular fracture type with some dislocation. But if you have that carpometacarpal joint instability, so if you have that as documentation, that would be a separate code. It's not automatically included because it doesn't always occur, but it is a common theme for the Bennett fractures. All right, your Rolando or your Rolando, whichever you want to say it. These are also fractures at the base of the first metacarpal. However, unlike Bennett, it is typically a comminuted intra-articular fracture. So both Bennett and Rolando live in that same general region, but Rolando is the more complex. Okay, with that fracture pattern, if we're dissecting our data source and looking to see what's actually broken, we know we have a fracture that is, again, going to be at the base of the first metacarpal, and the fracture is going to extend into the joint. Well, then what's the key difference? The key difference is the fragment pattern. So instead of a simple split pattern, Rolando is classically going to be this comminuted pattern type. And that means we have multiple fragments in that injury pattern, and therefore it is generally going to be less stable and considered more complex. Well, that definitely is going to impact our code choice. So we're asking ourselves, just like every time we try to decide on a code, is this fracture isolated? Is there a combination code? Is it a fracture plus a separate associated injury? So we're trying to determine, is it just a simple injury, or do we have a combination code that includes multiple injuries in that combo code, or do we need more than one? Now, your Rolando should be approached from the perspective of it being a comminuted, intra-articular, right, into that joint space, base of that first metacarpal fracture. Well, then the coding distinction here is not about a dislocation name as much as it is about the complexity of the fracture pattern. Well, if that's the case, trauma injury coders' mindset should be that same region, of course, for Bennett, but a different injury structure because you have more fragments. There's much more complexity. How they treat it is going to be different. You have more detail that's going to be needed in your record in order to assign a Rolando fracture. So that is kind of like our first big documentation pearl, but we still have to dissect more of our data source, right? So we're looking from the providers to see if we've got laterality. Is it truly a first metacarpal base fracture? Did they call it Rolando when it was actually something else? And then do we have that intra-articular involvement? And very importantly, you have to have that comminution for that fracture pattern. So there's multiple pieces of the bone. Look to see if you've got displacement or not, and then whether this is an open fracture pattern or not. Is this an open type wound, open fracture? And if there's any associated carpometacarpal instability present. Well, that's a lot to take in. I know we should have poured a whole pot and a half probably for this episode, but the key detail I want you to pay attention to is that word comminution or comminuted. That's going to be especially important here. That's going to be how we keep from spilling our chart when we're trying to assign these codes. So coders are commonly going to miss or make mistakes when they try to blend that Bennett and that Rolando together, because both occur at the base of that metacarpal, that first metacarpal, but they are not interchangeable. The big distinction is going to be the injury pattern, right? So your Bennett is classically a simpler intra-articular pattern, whereas Rolando is that more comminuted intra-articular pattern. So your take-home sip would be that your Rolando fracture or your Rolando fracture is a comminuted intra-articular base, still of that first metacarpal fracture, but the fracture complexity is what is going to absolutely set it apart from Bennett. That is your key difference. It's going to set it apart. So you've got some carpal metacarpal subluxation with Bennett, but with Rolando, you can see this is just a simple base of the metacarpal fracture versus with Rolando, you've got this comminution. So going back to our coding piece, you can see that Rolando fracture, that S62.22 is going to be the subdivision for that code. And then, of course, you have options for that displacement of laterality, right or left, or non-displacement, right or left. When we look at our tabular list, we actually have a combination code for Rolando. So it does include those details of that comminution in that fracture pattern. And then, of course, the details for any other complexity for intra-articular involvement at the base of that first metacarpal. So S62.22 is the subdivision of that code. And luckily, we do have the eponym available for us when we are working through our code assignment. That is your final coding take-home SIP for Rolando. So we'll move now into Boxer. Your Boxer fracture pattern classically refers to a fracture at the neck of the fifth metacarpal. It is one of the most commonly recognized hand injury eponyms, but even common injuries still need specificity. So if we do a quick pattern check and ask, what is actually broken or dislocated? Well, what's fractured is the fifth metacarpal neck. So we automatically know that makes it different location, not in the same neighborhood at all as where Bennett and Rolando live. Because now we're talking about not about the thumb base, we are talking about that first metacarpal joint involvement. We are talking about a fracture farther down the hand involving that small finger metacarpal and often associated with some sort of angulation. Now, in some cases, rotation may also be clinically important. That can help when we are looking at our coding choice in determining what all needs to be there. So when we're asking, is this an isolated fracture? Is this a combination code? Do we have just one simple code, for example, in our tabular list named Boxer, or do we have to look for fracture plus any separate associated injuries, which would be additional codes? Lots to say, right? So your Boxer is typically isolated. It's an isolated metacarpal fracture pattern. Now hold on. Don't take another sip and think, whew, you can relax. That does not mean that the coding is vague. The location still matters. You still have to have the specifics documented that it's a metacarpal fracture, and it should support whether the fracture is displaced or angulated or not, whether it's open or closed. You should be dissecting that data source and those data sources to see if you have any associated injuries elsewhere in your hand. And as documentation pearl, I would just say, look to make sure that you have laterality. So is it the left hand or the right? But for sure, the biggest documentation pearl is identify that it is a fifth metacarpal neck fracture before you even start looking for those other details such as laterality and open or closed patterns for the wounds, for the fracture, whether there's displacement or not. If there is displacement or angulation, see if the degree of angulation is stated and whether there's any rotational deformity or associated injuries with that, because those would be additional codes that you would need to assign. So even though we have a common injury here and the chart details will probably identify it as such, you still need to use the chart to tell the story, or you're going to spill the chart. And we don't want to do that. You're going to make mistakes if you're not diligent in your data dissection of those data sources. So common mistakes or misses is reducing a boxer fracture to just a simple metacarpal fracture without preserving which metacarpal, what part of the bone, and whether the angulation or rotation is present. Second mistake that's very common is just assuming that all punching injuries are boxer injuries or fractures. You still have to confirm that with the documentation for that anatomy of that fracture. So your take-home SIP is pretty simple, right? A boxer fracture is usually a fifth metacarpal neck fracture, and even common hand injuries still require precise location and pattern detail. So if we're comparing all of these, so if we're looking at all these, we've got our Bennett, we have our Rolando, and we have our boxer. So it's helpful to understand your thumb base intra-articular, which is your Bennett and Rolando, versus your fifth metacarpal neck angulation contrast, which is your boxer. Okay, so this illustration just provides a great quick review of those differences between the Bennett and Rolando epinym fractures, since trauma coding professionals often mistake one for the other. Your key differences is in the complexity of each, specifically that intra-articular involvement of the fragment of the bone. So both include first metacarpal base with Bennett and Rolando, but complexity and that pattern of the injury is what is going to be essential because Rolando will have that comminution. And then, of course, your boxer is in a different. So we moved from here in our first metacarpal all the way over to our fifth. And now we're moving from the base to the neck. Okay. And don't forget to look and see if you have any dorsal or some sort of angulation or dislocation. So let's look at our coding SIP, our final coding SIP for that fifth metacarpal base of our fracture for our boxer. So we do not have boxer eponym available in our ICD classification system. That's okay. Even though we don't have a combination code in the indices for boxer eponym, you can still assign the injuries, right? You just have to follow that documentation of which injuries are present for your boxer fracture injury pattern. And we know there's a metacarpal neck fracture for this one. And then we've got that subdivision of the code. So as always, you're going to code to the highest level of specificity available in the tabular list descriptions per your conventions and guidelines. And that includes your laterality, and then whether it's open or closed, and whether or not you have displacement or not, in addition to any additional injuries. So for that fifth metacarpal, you note it's not the phalanx, but it's the metacarpal. So you want to make sure that you are looking at that. You've got your base here listed on this screen. Look also for the neck. So if you're looking at the neck, then that's going to take us out to the S62.33. And then you would have the same 6 character values for like 0, 1, 2, 3, respectively on the displacement and whether it is right or left. So I've given you both. I've given you that displaced base of your fifth metacarpal, as well as using your alphabetic index for the fifth metacarpal, and then taking that out to your neck as well. So that kind of brings us to the end of this SIP, and I feel like I've had a whole pot. So your hand eponyms are going to remind you. Hopefully they keep you on your toes and teach you that small bones can carry big details for coding. Your Bennett taught you to recognize the base of the thumb fractures with joint involvement and instability. Rolando taught you that fracture complexity and comminution are critical. And your boxer fracture eponym reminded you that even common metacarpal injuries still need specific anatomical details. So we needed to know if it was first or fifth. It changes it, right? And that's really the teaching point for episode 5. Do not code the hand injury by bone name alone. Code the location. So you're going to be looking for the location. Code the joint involvement. So when you're thinking location, you're thinking base or neck. Joint involvement, is it carpal, metacarpal? Where is that joint at? Which joint is it? Looking for any comminution. So those fracture patterns of the bone, is it in multiple pieces, or is it a simple linear type fracture or a Y type? Look for any instability. So do we have some angulation or dislocation? And just make sure the pattern matches what is documented according to the anatomy, so that you don't miss or mistake all those injuries and underrepresent the nature of that injury. So your final sip for episode 5, your hand eponyms are going to teach you that accurate coding is going to depend on more than identifying the metacarpal. It requires recognizing the exact fracture location, base or neck of the metacarpal. Looking for articular involvement, comminution, and instability is what is going to define that true pattern for these hand injuries. So that's today's coffee convo on trauma coding. Keep honing the art of trauma coding, one case, one code, and one fresh pour at a time. Next episode, we are going to be moving into our spine. We're going to be looking at Hangman, Jefferson, Clay Chaveller, Chance, and Holdsworth. And that's where level, mechanism, and instability language really begin to shape our coding conversations. So until then, y'all stay safe, stay diligent in your abstraction and code assignment, and keep making a difference in injury prevention, stronger trauma systems, and better patient care through quality data. I'm Amanda Truelove, and trauma truly is my heart's work. I hope to see y'all soon for another fresh pour. If this episode was helpful, please like, share, subscribe, and comment to support the channel. Sharing with trauma professionals and others who can help expand the reach of this content truly will make a difference. Your engagement will help grow the platform, increase visibility, and build the sponsorship support needed to help keep this educational resource free for the trauma community. See y'all for the next pour.